Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about autoimmune diseases. When I left off last week, I was talking about red cell associated autoimmune problem, namely uh, hemolytic anemia. And I left off when I was going over the different tests that have to be done in order to arrive at the diagnosis of autoimmune hemolytic anemia. And I'm going to continue to do that before I get to the treatment of it. However, I want to borrow a little bit of time from you to bring you in uh, uh, to talk about the fact that last night I had a great evening at the. It was an incredible evening, in the fact that the Mount Vernon Neighborhood Health Center Network Board of Directors chose to honor me for a lot of work that I've done over the years. I get the Achievement Award. It was a beautiful affair. My goodness, the music was fantastic. The food was extremely tasty and delicious, and everybody was well groomed, well dressed. I mean, it was just an incredible evening, and I wanted to take a moment to give you a little background as to why they honored me. I received this huge plaque, which uh, uh, with with my name and the honor, blah 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 blah. But before that, in addition to that, I received so many certificates. I think about six of them. One from the county legislator, Westchester County legislator. One from the New York Assembly. One from Congressman Engel. One from the mayor of Yonkers. One from the mayor of Mount Vernon. On and on. It was incredible. And the main reason why I was honored last evening is because, believe it or not, I had a lot to do with the construction of community health center in the United States of America. And I brought with me my two friends here from the studio. Number one, Jim Kenny, the executive director of community media, and my good friend Dennis Lantier, who's direct most of my shows recently. And what was interesting about that is that many, many years ago, almost 40 years now, I wrote an article. In fact, it was the very first article that I have ever written on my own of any type. I had done about maybe three articles I was co-author of at Montefiore during my training days. But this particular article was written specifically to lay out the findings of the first community health fair that was ever done in the United States at James Monroe High School in the Bronx, where I was the one who set it up. And of course, Westchester has a lot to do with it that I was just explaining to Dennis recently, I mean, a while ago, namely that it was a company that was located near Benedict Avenue going toward that beautiful restaurant up the street from it. That turns out to be subsequently the Bear Aspirin building. There was a company there named Technicon, and Technicon company president, we, a couple of other students plus myself, went there to talk to him, to tell him about the idea of the health fair we had planned to do. And of course, he gave us all the machine. Technicon used to do laboratory machine. That was what the company was there for. And the president gave us the machine to do blood chemistries, complete blood count. We did everything, urine analysis. The man gave us all the workers and all the machines for free. Spent there since 2 o'clock in the morning until we finished around 6 p.m. It was an incredible experience, and I don't know where this man is right now. It turns out that who would have known that this was going to be the first health fair, community health fair ever done in the United States of America, and I did that. So, however, many years later, I came up with the idea with all this finding. We saw 2,800 people. That is 2,800 of everything that was done that day. It was the first time in any place in the United States you have 2,800 blood pressures, pulses, temperature, weight, height, complete blood count, chemistry, sickle cell prep, VDRL, on and on and on, urine analysis, all the rest of it. I decided that I should publish that. So I put it together. I was learning how to write, never written anything before other than the article that I mentioned. I was a co-author and, of course, doing paper for college work. I wrote this article and I documented all this stuff, program everything, and I sent it to the Journal of the American Hospital Association, which still exists. It's a public health journal. and they were so excited they published it. Within 3 weeks, it was published. And in that article, I proposed the notion that the best way to bring health care to the ghetto poor, I use those terms, was to build clinics or community centers whereby these individuals will be able to come in the evening. They could come on Saturday, and some of them are working two jobs. They don't have time to come, etc. Furthermore, I mentioned the fact that they will feel more comfortable because they'll be providing care for by minority physicians with whom they have a lot in common. And sure enough, a few days ago, you can't make this up, a few days ago, on the AMA website, here's what came out. I'll read it for you. Outcomes for black patients may be better when they are treated by black physicians. You can't make this up. This just came out on the 6th of May, 2019. Okay, and it's a long article. I won't bother to read it to you. And this is the very same idea that I outlined in that article that led to the formation of community health centers. It was read in the congressional records, and the rest is history. And it is copyrighted. A lot of folks over the country have tried to get credit for being the person that came up with the idea for the construction of community health center. Bogus. They can't do it, anything about it, because I wrote the article first, and it was in a peer-reviewed journal, and of course it was copyrighted. Okay, so I did the first community health fair in the country, and and it was in that article that I wrote about the health fair that we had done that I mentioned the need for the formation, construction of community health centers as to bring health care to what I call the ghetto poor. Okay, and this is it. You can't make this up. So last night, it was fantastic. I was awarded, and Miss Judith Watson, who was the Chief Executive Officer of the Mount Vernon Neighborhood Health Center Network, mentioned that in her fantastic presentation of me, introduction of me, I should say. It was unbelievable. It was a great evening, and please, whenever they're doing it again, do go there. Okay, I just want to share that with you. When you have ideas, don't just think they're not important. Write them up. Make sure you write them in a format that they can be published in a peer-reviewed journal and they can be copyrighted. You never know what's going to happen down the line. These many years later, after all these folks trying to get credit for it, now, in case you did not know, 26 million people are provided medical care for in community health centers throughout the country. How about that? And this idea came from my head. Okay, so now let's get back to, again, once more, thank you to the neighborhood, Mount Vernon Neighborhood Community Network for being so nice to me and my guests last night. Jim was there, and Dennis was there, and Mark Carter, my good friend, was also there as my guest. Now, let's get back to the subject on hand, which is the hemolytic anemia. What is hemolytic anemia? Hemolytic anemia, there are different types of anemia. There are different types of hemolytic anemia, but autoimmune hemolytic anemia is there is something that happened to the human body whereby an antigen and antibody form, and the body is fighting against itself, and then the antigen antibody complexes piled up on top of red blood cell, and that then the body reads them as a foreign substance, and the spleen chew them out, they get hemolyzed, and they get destroyed, and the person becomes severely anemic. And then the cause of it can be different. Almost always, autoimmune hemolytic anemia is associated with another autoimmune disease of one type or another. You just have got to know how to look for it. You're going to find it. Very important, because if you don't find out what it is, you could treat the hemolytic anemia, but it's not going to go away, because it's going to come back because you did not treat the other autoimmune disease that it may be associated with. And I'm going to give you the list, a partial list actually, so you understand the other diseases that can be associated with it. Okay, chronic lymphocytic leukemia, non-Hodgkin lymphoma, ovarian cancer, lupus, multiple myeloma, HIV/AIDS, hepatitis, rheumatoid arthritis, mixed collagen vascular diseases. The list of mixed collagen vascular diseases involve many, many different diseases, at least 12. And as the series goes on, I'll be going over each one of them for you individually. This is going to be a long series, okay, because you're talking about autoimmune diseases. It's a very long list of things. In addition to that, there's several medications that can also cause somebody to have autoimmune hemolytic anemia. Among them is quinidine, metal-dopa, hydralazine, Tylenol, ibuprofen, alpha interferon, cephalotin, insulin, sulfite drug like Bactrim, hydrochlorothiazide, rifampin, streptomycin, penicillin, etc. Okay, so you have got to understand this is serious business, because when somebody is hemolyzing, unless you diagnose it quickly and fast, they're going to keep hemolyzing. They can drop the hematocrit, and if they're older, that can lead a lot of other problems because they cannot perfuse the body. They cannot perfuse the body with oxygen, because when somebody is very anemic, as I mentioned last week, the oxygen dissociation curve, which is an invisible curve, it's right there in the center. If it's moved to the left, the red blood cell hold onto the level of oxygen they're holding. They will not release it to the tissues of the body, because of the severity of the anemia. If it is shifted to the right when the anemia is resolved or improved, only then would the red blood cell begin to release the oxygen that's attached to them to the tissues to perfuse them. It's a very important concept to remember, okay? Very important concept, okay? Now, I talked about the fact that one has to do we take a complete history from the patient, total. Leave nothing out. Patient complete history. Where does the patient work? Where has the patient traveled recently? What medication is the patient taking or has been taken for the last, or took maybe several weeks ago? Okay? What are the diseases that the patient is known to be afflicted with? Very important. What kind of work the patient does, because exposure to certain toxin at work may be part of the reason, and so on and so forth, okay? The patient's family history is very, very important. The patient's social habit. Is he or she a smoker, an alcoholic, or she or she taking drugs, intravenous drug, or taking other medication by mouth and so on? What medication is patient taking, as I just mentioned? The family history is crucial, because if you have the certain diseases your family has had that you may have inherited, that's now causing you to have this problem. Very crucial. Then you do a complete, thorough physical examination. I mean, really thorough, because some of the things that may first bring to light that the patient may be having a problem is on the skin, like a rash. Take a look at the hair. Does the patient have alopecia? Is the eyebrow normal? Because the eyebrow sometimes may be the first indication that somebody has a bad disease, because the eyebrow disappear, and so on and so forth. Take a look at the nose, the eyes, the lips, the mouth. Very crucial. Check the neck to make sure there is no thyroid enlargement, and so on and so forth. Now that you've done all that, make sure you get a good lung examination, a good cardiac examination. Does the patient have a murmur? What type of murmur is it? Examine the abdomen properly. Is the spleen enlarged? Because the spleen enlarged, the liver enlarged. Because those things can be very crucial in causing the patient to hemolyze. Okay? Because the anemia, so far, you don't know if it's a hemolytic anemia yet. Because if the liver is enlarged, the spleen also is enlarged, hepatosplenomegaly, that itself can cause somebody to hemolyze. Okay? Is there a mass in the abdomen somewhere? And so on and so forth. Does the patient have any muscle weakness? Because the patient have polymyositis, polymyopathy. Those are other diseases that can cause the patient to be hemolyzing. Because polymyositis can be, almost always is a autoimmune disease, which can be associated with anemia. A patient have muscle weakness. Suddenly the patient can't walk. They have to walk with a cane. Why is the muscle weak? And so on and so forth. Now that you've done the thorough examination, now you're going to start ordering some tests. Let's start with the blood test first. Where you do a complete blood count. You do a complete chemistry profile. You do a urine analysis. You do a thyroid profile. You do a SET rate. You do an ANA. Okay? You do a crucial to do an LDH because when somebody is hemolyzing, the LDH is going to be high. If someone has some sort of occult malignancy that associated with the hematological malignancies, the LDH is going to be high. Okay? So that's crucial. The LDH is crucial. It gives you a lot of information. You do a total CPK. Why are you talking well, I just talked to you about muscle weakness. If you have muscle weakness, the muscle may be weak because there's polymyositis or polymyopathy. The CPK is going to be sky high, and so on and so forth. Okay? So you do all this stuff, and then, important of all, in addition to that, you're going to do hemoglobin electrophoresis. Crucial. Why? Because the patient may have an abnormal hemoglobin. That may be causing the individual to hemolyze. It may not be autoimmune at all. The list of different abnormalities that can cause somebody to hemolyze is quite long. Could be sickle cell disease. It could be thalassemia. It could be alpha thalassemia. It could be beta thalassemia. It could be hemoglobin C disease. I mentioned last week, and I'll repeat it again. Someone were to ask you, what is the most common hereditary disease that one will find in a Negro person? The answer is alpha thalassemia. How about that? Let me repeat that. Alpha thalassemia is the most common hereditary disease in Negro individual. It's not sickle cell disease. How about that? What are the numbers? 32% of a Negro individual in this country, no matter what they want to call themselves, no matter what degree of immediate Negro blood they have in the bloodstream, no matter what they look like, 32%. 30% is missing one alpha globin chain. They don't know anything about it because they're not anemic. 2% are somewhat anemic because they're missing two alpha chain. How about that? And they don't get sick. They don't get sick from it. They say, well, why, how come? Well, you go and speak to God. You and I know God is powerful. Let me explain to you what I'm talking about. If you're a Negro individual, you're missing two alpha chain. You're going to miss them on the opposite side. How about that? If you're not a Negro individual, you have no Negroid, immediate Negroid blood, you're missing two alpha chain, they're going to be on the same side. Guess what? That's a terrible abnormal hemoglobin. It's called hemoglobin constant spring. You go and figure out why a Negro individual is missing two chain on the opposite side. They don't even know anything about it. And then if you're missing two chain on the same side, you are so sick, you have hemoglobin constant spring, which is the #1 public health illness in Southeast Asia. How about that? Only God could have done something like that, okay? You're missing two chain, you're missing two chain. No, you're not missing two chain, you're missing two chain. Where in the equation you're missing them? On the same side or on the opposite side? See, this is why you have to understand something. I said it often, I'm going to say it again, and I couldn't care less what people feel. 21st century, high-powered academic medicine is big business. It is serious business. You either know it or you don't know it. And to know it, frankly, you must be in the business of not only practicing clinical medicine, you must be in the business of lecturing about clinical medicine, writing books about or articles about clinical medicine, and most important of all, you have to be teaching about that stuff. Because every week, things are changing. Every week, things are changing. And people who are in power say things that is completely not true. I read an article right here. It's in my cell phone from the CDC 2 days ago that talks about pre-diabetes. I'm here to tell you there is no such thing. They were making a big point talking about how important diabetes is that somebody pick it. There is no such thing. It doesn't exist. There is no. You could tell them Valiere Alcena say pre-diabetes is bogus. Why is it bogus? Let me tell you. I'm saying to you on television, you could quote me. If you develop diabetes mellitus, your sugar goes up, and the physician didn't do anything by way of giving you steroid, and first of all, to cause your sugar to shoot up because the doctor did something that you needed, such as giving you a steroid. I'm giving an example. Your sugar should go up. If the blood sugar goes up by itself, above the normal blood sugar is up to about 108. The blood sugar goes up. They have the level. If you are uh, between 110 and 123, you're pre-diabetic. If you're 124 and above, you're diabetic. Bogus. Because let me tell you why it is bogus. In order for your blood sugar to become elevated by itself without me doing anything or any physician does anything to you, it was fasting. The blood sugar is up. That means, let me repeat that, you have been diabetic for at least 10 years. You've already lost 80% of your pancreatic function of beta cell. Let me repeat that. If that happens by itself, the blood sugar is abnormal. Forget about the level they're talking about. It's abnormal. I didn't do anything to you. I didn't give you didn't eat. I didn't give you a steroid. That means, let me repeat, you've lost 80% of your pancreatic function as it relates to beta cell. In addition to that, you have been diabetic for at least 10 years. You didn't know about it. You say, why not? Well, a lot of patients show up in the office having cramps in their legs, tingling, feeling unwell. They don't know what's going on. They're diabetic. You know why they're diabetic? Because they are not able to use sugar properly. Let me repeat that. Because they've lost 80% of the pancreatic function. Therefore, they're not able to use sugar properly. They are using fat as a substitute to make up the difference. The fat cells are breaking down, resulting in ketone bodies. That's why the production of ketone bodies, which are very toxic to the body. We talk about ketone bodies only when somebody have diabetic ketoacidosis. That's not enough. When you cannot use glucose properly, the body needs to make the difference to get energy. You start burning down fat, and the breakdown products of the fats are ketone bodies. And when you are using ketone bodies for fat, the accumulation of ketone bodies is what causing you to have all these lousy symptoms in your leg, the cramp, the this, the that you're having, because you are diabetic, my friend. Those are toxic to the body. Ketone bodies are toxic to the human body. I know that I shouldn't be teaching you that stuff because none of my business. If you want to think there's pre-diabetes, you go ahead and think so. Okay, that's your business, but it's not my business. My job, I'm telling you, you've been diabetic for at least 10 years. And take it in the book. Look at what I just read to you from the AMA about black physicians versus black patients. I talked about that almost 40 years ago in an article. And most of the books that I have written, there's no other doctor in this country that have championed the cause of black folks and minority folks than I have. I devoted my entire career doing it, and I paid a price for it. My defense and fighting on behalf of minority doctors, not for money, for their right, has multiple times tried to cost me my license because the racists at hospital that I will not mention went after me because they don't think black people deserve quality care, and it was my job to provide them quality care. Therefore, I had to go. I had to go. The order was given years ago to take me out from the highest up. They failed. I whipped their butt at all time. I make them look like jackasses, which they are, most of them, because they don't know what they're talking about. They're just simply using their social and political advantages to try to think they can bully people around. They couldn't bully them around. They tried. They tried everything. If they tell you the one single thing that could have been done to take somebody's medical license away, they haven't done. They're lying. They did it all. And I've proven them to be nothing but, some of them are nothing but medical imbecile. They don't know anything about anything. They think they do, but they don't. And I'm not going to back down. Because look at what I just explained to you about pre-diabetes. It does not exist. People who say they exist, they don't understand the concept. They have not taken the time to research it, to figure out. This is the first time you heard that when somebody is pre-diabetic. How can you be pre-diabetic when you already lost 80% function of your beta cell production, and you can't make them over? You lose your beta cell, you lose them forever. There is no such thing. They don't regenerate. And I'm here to tell you, you lost 80%. So the least little thing that happened that caused you a stress, like an infection, the sugar shoot up to 300, 350. Overnight, just like that, it shoot up because you were missing 80% you didn't know. When you cut your toe, it wouldn't heal because you didn't know why. Because when you are diabetic, you secrete a whole bunch of other sugar besides glucose. And one of the sugar that is the most toxic is sorbitol. That damages the nerve, that giving you all these crazy symptoms. Plus the fact that the ketone bodies are toxic to the human body. We're not supposed to break them down. When you break them down, they are toxic to the tissues. And you're using it because you cannot use glucose properly, because you lost 80% of the function. So you understand, when somebody's sugar shoot up to 400 overnight, it didn't happen overnight. They've been diabetic for a long time. They're having eye problem, glaucoma, blindness. They simply didn't know. It is not my job that these people don't know this stuff. If I didn't know this stuff, I wouldn't have a license to practice medicine today. I had to know 50%, 75% more than the people who were after me. It used to be 25. It became 50. I had to know 75% more than they will ever know if they live to be 5 million years. Okay? I survived 6 commissioner of health in the state of New York. Let me repeat that. 6 or 7. I think it's more than 7. I think I'm on the 8th one now. Many of them were given the order by the powers to be to take this guy out. He talks too much. We don't like him. He said things we don't agree with. Take him out. Like they sent me to medical school. They spent 14 years to pay my bill for me. Those racist pigs, they look like the fool that they are, which they are. Pretentious, know nothing, pretentious, pseudo-bourgeois. Not all of them. I got some good friends who are quality people, but most of them nothing but craps. In any event, as it relates to autoimmune hemolytic anemia, you have to do a direct Coombs test. You do all these other tests, you did your reticulocyte, you have to do a direct Coombs test. There's a cold hemolytic anemia, there's a warm hemolytic anemia. The direct Coombs test will nail it for you right there and then, and you know it is not just a hemolytic anemia, but it is autoimmune hemolytic anemia because the direct Coombs test is positive. Listen, I'm going to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.